please remember to take a moment to just to double check and make sure your lines are muted, and also not make sure you're not put us on a hold music to avoid that background noise as well. As the month of March winds down, we can reflect on celebrating Patient Safety Awareness Week for 2018. We know as leaders in the front lines of patient safety that there are a number of ways that we can engage and take an active role in patient safety. Every day is Patient Safety Day, and it's important to always remember that we are all patients. First, on behalf of Compass HIN, we'd like to thank you for your efforts in patient safety each and every day. And if you'd like to please take a moment to pause for a moment and think on your efforts and their impact on the patients and communities we have served. And if each of you would like to maybe place one item in the chat, ways you've engaged patients this past month for Patient Safety Awareness Month, or even just efforts over the past year. Surely we are all in different places in our journey and can learn and support from each other. Where is your organization in the pursuit of safe care and zero harm? The IHI White Paper, the Framework for Safe, Reliable, and Effective Care, provides clarity and direction to healthcare organizations on the key strategic, clinical, and operational components involved in achieving safe and reliable operational excellence. It's about designing a system of safety, not just a collection of standalone safety improvement projects. It's not a program, it is a culture. The IHI has stressed two critical issues and the focus of 2018 Patient Safety Campaign: safety culture and patient engagement. And as I said earlier, today we are fortunate to have John Westfall from the Chief Advisor with Outcomes Ingenuity to speak on just culture. As Chief Advisor, John has more than 2 decades of experience in high consequence industries. He has worked with NASA, healthcare organizations, energy companies, and even the airline industry developing prevention strategies using the socio-technical probabilistic risk assessment methodology. John also trains organizational leaders in the 5 skills and proper use of Just Culture algorithm and Just Culture certification courses. With that, I will turn over to John.
Thank you, Sean. Good morning, everyone. It's a pleasure to be here. I'm going to quickly run through the attributes of a Just Culture just to give you a sense about what the model or what a Just Culture entails. So with that, Sean, could you go to the next slide, please? So the first thing that we have to make a commitment to is all of our employees. It's a covenant. Just Culture is a covenant between senior leaders and all employees. And at some level, what that says is that as a senior leader, I commit to everyone in the organization is going to be accountable for the quality of their choice and the quality of the systems they design. In essence, no one gets off the hook. And accountability doesn't necessarily mean that it's discipline. It means that you learn from the mistakes that occurred within your organization. You learn about the choices where you drifted and how that introduced more risk into your process. And it starts that learning culture, but it starts with that covenant between senior leadership to all employees. Next slide, please. The second attribute is that Just Culture is about all your values. It is not a safety program. This is about how do we manage all the competing values. And the thing I like to always the way I think about culture is your culture is what your people are doing when you're not looking. And we have to know at some level what are the values that are driving choices within your organization. And so again, this model, Just Culture, our Just Culture model, is about really identifying all the values and managing to all the values. So it is not just a safety program, because finance is a value, patient satisfaction is a value. There's a lot of values at play, and they sometimes will compete and conflict with each other, and we have to have a recognition of that. Next slide, please. The third attribute is, as an organization, this might be your steepest challenge. I just actually was with an executive team yesterday in a large hospitals, and we had a lot of conversation about this one, where in order for us to really have justice within our organization, we as leaders and the organization itself has to be able to set aside the severity of the outcome. We can't allow the severity of the outcome to drive our decision making around accountability. And the way in which I would address this is just culture, your justice system, is about the allocation of accountability. And to do that well, it must only look to the quality of choice, not how bad the outcome was. Your learning system, which has the responsibility to allocate resources, must take into account the severity of the outcome because it's allocating resources towards the greatest risk. But in regards to justice, we have to set aside the severity of the outcome, which in many ways is a significant challenge for any organization. But it's the thing that if we do it well, we don't punish people for making errors. We don't overreact to the single event. And at some level, and maybe the larger issue is we don't allow a reckless person to go unchecked. We don't have that culture of no harm, no foul. Next slide, please. In establishing accountability and recognizing when we do need to hold somebody accountable, the first thing we must establish is there was a breach of duty. And our model, the Just Culture model, really takes into account there's three duties that are always at play. There's the values-based duty, which is the duty to avoid unjustified risk or harm, the duty to follow procedural rule, and the duty to produce an outcome. And the duty to avoid causing unjustified risk or harm is really those instances where we say refrain from. And it's almost always present, and we call it the values-based duty. The duty to follow procedural rule is when we say how to. Here's how to do something. We're going to ask you to come be a part of our system. And the way in which you would, the unique characteristic with duty to follow procedural rule is that there's shared accountability around the outcome. If you impose duty to follow procedural rule on me, and you ask me to do something, I do it exactly the way you said, and we still have an undesired outcome at that point, you own that outcome because it was your system that failed. And the duty to produce an outcome is where you simply say to me, here's the result I want. How you deliver upon that is totally up to you. And so those are the three duties that we seek to impose, and we must identify breach before we can make an assessment about accountability. Next slide. When we have a breach of duty, we then get to, okay, what was the quality of choice within that breach? And if we identify human error, we simply say there was no choice. It was an inadvertent action, and we seek to console the error and redesign the system. If we see at-risk behavior, we coach and we work to see how did this quality of choice, how did this drift come about within our organization or around this particular employee. It's the reckless line where we start to draw the line in the sand. Reckless and above starts to become disciplinary action. And if someone engages in a reckless choice, we go to our HR disciplinary policies and engage them in that way. If we identify that they knowingly caused harm or they had purpose to cause harm, at that point, you're really going to probably remove them from the organization. And I want to be very clear in the spectrum of human behavior. The driver of risk here is not reckless, knowing, or purpose. In your career, you may rarely see someone that will knowingly cause harm or purpose to cause harm. Matter of fact, I hope you don't. You will see some reckless employees. That happens, particularly around conduct. The driver of risk, though, is the at-risk behavior. It's all the times in which we think we're in a safe place and we're not. It's the drift. And this is where we really work to mitigate the risk of harm towards our patients and our staff and towards the organization. Next slide, please. It's in addition to understanding that we have to identify a breach of duty and we're going to look at the spectrum of human behavior, we also must allow for justifiable breach. And this gets to the point where our Just Culture model is not about the rule, it's about the value. And there are times when the rule, if I follow the rule, I harm the value. And that's at some level what justifiable breach is. It's recognizing that, yes, I broke the rule, but I broke the rule to support a value. And a classic example of that, it would be if I'm walking by a patient's room and I see a patient starting to roll or fall out of the bed, and I run into the room to catch them without washing my hands. You have a justifiable breach. Yes, I broke the rule. I did not wash my hands. I did not engage in proper hand hygiene protocol prior to entering the room. But there was a justifiable breach. There was the value of saving the patient from an injurious fall. And therefore, you have the justifiable breach. And every model of justice must contain at some level a justifiable breach in order to be just. Next slide, please. In addition, we want to make sure within our just culture that we look beyond the one bad day. And it's really about trying to assess our employees' body of work and how we fall into that trap of what have you done for me lately sort of thing. And when we look at our employees, we want to make sure we take that step back and say, yes, really bad week last week, harmed a patient, bad event, whatever it might be. But let's go back and look at the body of work and say, you know what? Yeah, there was an error here last week, but overall, this is a really good employee. And so, again, to be just, we want to make sure that we're looking across the body of work and not being overly influenced by one bad assessment or one bad day. Next slide, please. The other piece of this just culture model is creating that partnership with the regulator and having a dialogue. And that I think is happening on a national level. Matter of fact, the HINS and all of these sorts of organizations are starting to create a really active dialogue, and IHI's influence and the Joint Commission, and even with CMS is coming in and starting to have a bit more of a dialogue around just culture and what it means to have a good culture. And again, I think as an organization, we have to pursue that and work as hard as we can to get our regulators on board with the fact that to create a learning culture, we have to move away from this overly punitive whack-a-mole sort of system that really has demonstrated to be ineffective over the last 10, 15 years. Next slide, please. And again, at the end of the day, we work hard within this model to establish that learning is our highest form of accountability. And I would make the argument that discipline is just simply the game of don't get caught. And actually, my son taught me this. He got in trouble one time. I said, Ethan, we got to talk about this. And he said, Dad, just send me to my room. And I said, no, we got to talk about it. And we actually got an argument about him going to his room. And it was kind of it struck me in that he was simply saying, look, let's just play the game and don't get caught. I did something wrong. You whack me. I'll go to my room, and then we don't have to deal with it. Whereas if we have a conversation and we talk about the quality of choice, now I got to own it. And we would argue that's the higher form of accountability, when I have to own my choices, when I have to recognize that, yeah, I was drifting and I did put others at a greater risk. Now I have to really change the quality of my choice going forward. And so within this model, we worked hard to establish that learning is our highest form of accountability. Next slide, please. Oh. Hello, can you hear me? Can we go to the next slide?
Yes, we can, John. Am I on the right slide? It's starting.
Oh, sorry. Gosh, I sorry. And sorry, I lost my place. And then the next piece of this model, the next attribute is how do we develop a sophisticated learning system? And again, I alluded to this earlier, is that the learning system must allocate resources to manage risk. And I think the key to a good learning system is a learning system that is able to, at some level, explain the error and the quality of the choice. So anytime I see an error within a an event or an at-risk behavior, do I have the preceding cause to that error or choice? And one of the articles that my colleague and I, David Marks, wrote here just recently, and I think it's one of the better ones we've written in a long time, it was that human error is never the root cause. And so many times I think we fall into this trap within our learning systems that once we identify the error, we feel the investigation is complete. And I think that is very far from the truth. The reality is that the investigation is just beginning. You got to identify all the preceding causes to the error. And a lot of times the preceding cause to an error is a set of choices or a bad mental model. And those are the sorts of things that our learning system has to be sophisticated enough to pull out. And that's just a reactive learning system. We also want to ensure that we work around the proactive and prospective learning systems. Next slide, please. To really facilitate a better implementation and to help hardwire Just Culture into organizations, we in essence took the current hard copy algorithm and we put it into a software package, and we call it the Just Culture assessment tool. And it has built-in advisors. And at the end of the day, it's really a tool to help to put into the hands of every manager so that we're more fair and consistent and consistent in our approach to Just Culture. And when we think about the attributes, we really think of at some level about the famous quote by Vince Lombardi, who said, to pursue perfection or in pursuing perfection, we achieve excellence along the way. And that's at some level what we see here is we're never going to be perfect, but with the right tools and getting everyone on the same page, we can achieve that excellence. And Just Culture assessment tool is, I think, the way a very good tool to help with that and really hardwire this into any organization that goes along the Just Culture journey. Next slide. There's a quick basis for the tool, and I'm not going to spend a lot of time here. Basically, this tool has two components: systems engineering and the law. And when you walk through our 2-day CERT course, you kind of see that play out. But this is the basis for the tool. Next slide. And the next slide, Sean, please. What I want to get us to here to kind of wrap up my part of this is there's kind of 8 steps that are involved in a Just Culture implementation. The first one being we got to get executive commitment. From there, we got to create an internal resource. That's have a champion team that the managers can reach back to when they have questions. We need to update our policies and practices. And that's not a significant deal, but it's really understanding where might I have some policies or practices that are not in line with Just Culture. Then we want to train all our frontline managers. And from there, work to start developing this learning culture where we can create this environment where people can raise their hands and let us know when they've either made an error, drifted into an unsafe place, or identify a system that is broken. We have to enhance our learning systems. We need to refine them so they're better at explaining the error or the choice. And it's at this point, once you're through steps 1 through 6, I think it's at this point now that you are prepared to go out to your staff and say, we're working hard, or we are a Just Culture, and we're gonna console your error, we're gonna coach your at risk, and it's only when you're reckless will we engage in corrective action. But I always caution every organization before you go to your employees and say, we're a Just Culture, make sure that you're able to deliver on that promise. I think it will take you 3 years to build a Just Culture and 3 days to tear it down. And so it's one of those things that you really need to be able to make sure that you can walk the talk. And so before we go to step 7 and train all the employees, 1 through 6 is critical, and you got to give yourself time to do that. And then at the end of the day, we're just measuring progress. And there's a lot of ways to go about measuring progress, but and I couldn't get into all of them today, but at the end of the day, you want to make sure that everyone's using the algorithm. We're monitoring the event reporting system, and we're looking at the rate or number of at-risk behaviors that we see within the organization. Next slide. Next slide, please. And that's the end of my spiel. So thank you for your time. I know we might have a few questions, so I will wait to see if there are any questions. But again, thank you for your time today.
Thanks again, John, for taking the moment to speak on Just Culture. As John just mentioned, if you have any questions, feel free to put anything in the chat or unmute your line and ask outright.
So it looks like we just have some comments in the chat box here. I'm just going to scroll through real quick. A couple hellos from a few folks on the line. One question, are hard copies still available and for the algorithms, and are there any cost differences in laminated versus the software program?
Yeah, so hard copies are still available, and the cost difference is a single hard copy algorithm is, I think, $25, and then the software program is $79 per year per user. So if you bought 100 hard copy algorithms, do the math, 25 times 100 versus 79 versus 100. But again, I think the software package, it has a lot of features that obviously I couldn't get into today. I think one of the key ones that I would say is really important is each question within the algorithm has what we call a built-in advisor. So it offers an explanation, example, and the definition of the question, and then there's like a 1 to 2 minute video with David Marks explaining the question on every section or every piece of the algorithm.
All right, I'm not seeing any other additional questions, but if anything comes to mind, feel free to put them in the chat and we can come to them later and I can share them with John. But again, I'd like to thank you very much, John, for coming to speak with us today on our March office hours and providing all the insight here with us. Thank you. Thanks again.
It was my pleasure. Thank you, guys. Have a great day.
You too. Okay, continuing on with our March office hours. Just here is a resource from the ECRI Institute's Top 10 Safety Concerns for 2018. Healthcare is striving to become an industry of high reliability organizations, and part of being a high reliability industry means staying vigilant and identifying problems proactively. This annual top 10 list helps organizations identify limiting patient safety challenges and offer suggestions and resources for addressing them. This is not meant to dictate the types of issues you should be considering, but rather provides you a starting point for conducting patient safety discussion and setting priorities. Here are a few more resources for many patient safety resources available to re-energize your efforts. The IHI campaign. Check out the safety culture assessment and join the discussion. Share your plans and to look at all the activity posted around patient safety. AHA, eliminating harm, improving patient care, the trustee guide. Some additional, the ARC patient safety culture. Surveys are tailored to hospitals, primary care, nursing, ambulatory surgical center, and community pharmacy. The surveys are designed to gather staff opinions on the culture of patient safety efforts within their work environment. This provides a pulse on where your staff perception is on patient safety. And the top 10 patient safety concerns from the ECRI 2018 is a great place to start. To wrap up today's discussion before moving on to some general HINT updates, Kate Carpenter shared from a HINT hospital on Innovation the other week stating, I am working on developing a safety newsletter. our patient safety team would like our patient safety goals and safety topics to be more visible to the staff. I plan on keeping this newsletter to one topic, doing a Did You Know section, a What is our hospital doing, and what can you do as a healthcare team member, and what can you do as a patient. Specifically, examples from other facilities or anyone to connect with for ideas. Feel free to place in the chat, does your organization have a patient safety commitment? Do they have defined a newsletter or any other way to connect with patients on safety? What is it maybe you're struggling with? Compass Inn is always here to help, and to always provide guiding and learning from each other is always a powerful tool. Innovation, always make sure to check there for trending topics or information that's being shared. Fall's Stepping On application is due April 1st, so I believe that's this upcoming Sunday. Pressure ulcer prevention, our toolkit, PDSA and EVP templates posted, and several upcoming free webinar learning events. Remember to always check Innovation for any upcoming events or news items to be shared there. Special projects update. We, of course, are in the middle of 2 major projects right now, but we also have Stacy Klinker from IHC as well to speak on Candor.
Thank you, Sean. IHC is excited to announce a summer training series coming up discussing communication and optimal resolution, or the Candor process. Candor is an early disclosure process for when an adverse event occurs during the course of patient care. Its key elements really emphasize early and honest communication with patients and families, care for the caregiver involved, and developing a non-punitive learning environment where process improvement is key. We will be working with national experts from the MedStar Institute for Quality and Safety. And in the organizations that they have helped implement Candor so far, they have shown a 55% decrease in total medical liability costs, 42% decrease in claims, a 47% decrease in lawsuits. And not only that, but really it helps to rebuild relationships with patients and families when harm does occur. We will be having an informational webinar on April 13th, where we will be discussing what Candor is with our experts from the MedStar Institute for Quality and Safety, how it looks both from a patient perspective as well as a provider perspective. And we will be hearing from medical malpractice insurers to get their take on the Candor process. During that time, we'll also discuss the specific offerings and time frame for the training series that will occur starting in June. Please click the link here if you would like to register for the informational webinar, or you can email me directly. I will provide my email address on Hinnovation if you have any additional questions or any issues that you would like to discuss.
Thank you, Stacy. The Opioid Guardianship, Project 2. We are actually getting ready to start our 3rd webinar, breaking down the silos, mobilizing your team. That will be tomorrow, March 29th at 11 a.m. The link is provided. And another training webinar coming up as well, April 12th, The Untold Stories of Diversion. For the first webinar, breaking down the silos, we will have Horn Memorial Hospital and Horn Physicians Clinics sharing about their partnership and implementation of the Opioid Guardianship Project 1. And we will also have Gutenberg Municipal Hospital and Clinics presenting on their pain management performance improvement team. On the April 12th, there will also be CEU educational offering for the Untold Stories of Diversion, so make sure to get registration as soon as you can. For the readmissions refuel, on April 11th, we will be kicking off our Phase 3 with our instructional webinar. The webinar will be held from 11 to 12:30. Information and registration information can be found on Hinnovation under the Events section. If you have any questions for the opioid project, you can always reach out to Lana Comstock with IHC, and for readmissions refuel, Kate Carpenter. Okay, Saving the date, we have the ARC Safety Program for Improving Surgical Care and Recovery on Friday, April 13th. This is actually a free event to attend, and please remember to always, if you're interested, send your enhanced recovery team to participate in an innovative and in-person training to connect with national leaders in enhanced recovery and other hospitals. I believe this Friday is actually the registration to attend, and I know a few spots are still available, so make sure to register as soon as you can. The Iowa Antimicrobial Stewardship Program Summit will be Tuesday, April 17th. This educational program will cover the program as the Centers for Medicare and Medicaid Services draft final rules for hospitals. By attending the summit, participants will understand the resources required and the tools available to develop and implement an ASB. This event is also free to attend. And also keep in mind that the Compass HIN May Learning Community on Tuesday, May 8th is around the corner. And remember to check HIN newsletters and Hinnovation for other events that are coming up for that. Make sure the registration will be coming out here shortly. I believe you should be able to see the drumbeat that will be coming out here next Monday, but always make sure to double check Hinnovation for all events that are upcoming. And here's a preview for our 2018 office hours that will be held in April. The Compass HIN has recently developed a new facility-specific readmissions reports to support hospitals in designing data-driven readmission strategies. During this special office hours presentation, we will provide an overview over these reports and coaching on how you might use them to improve readmission rates within your own organization. This event will be held on Wednesday, April 25th at 11 a.m. All right, that brings us to the end of our March office hours. If there are any questions, feel free to reach out to us anytime, put it in the chat, or open the floor for discussion.
Thank you very much, Sean. So real quick, I know we're a little bit over time, do we have any questions or comments? Let me open up the phones here just real briefly. The phones are opened up, so any comments, questions, thoughts that you'd like to share? All right, well, we are going to go ahead and end the call for today then. So thank you again for joining us, everybody. And again, if you have questions for John or for IHC staff, please shoot us an email or give us a call. Thank you, everybody. Have a great day.